Hello. Hi, everybody. We are seeing and expecting a full house for this session, so thank you all so much for your enthusiasm already for this topic. And just a heads up, we are adding a couple chairs in here. There are chairs. For some reason, this aisle right down here is all empty. I don't know. I feel like I'm like an airline person. Like this aisle right here, the middle seat is empty. Not so much here, middle seat though. But please do, if you can, take a seat. We have about 45 minutes together and want to make sure that everybody is fully in the room, can see the slides and all of that. So, all right. Well, first of all, welcome. I am Emily Feltrin, Senior Director of Federal Policy and Advocacy with our Policy and Advocacy team. And we are really excited to have you. I am joined by Taylor Kleffel, our Director of Legislative and Policy Analysis, and Siobhan Power, Advocacy Ambassador from New Jersey, and Allies in Action Sandy Martin winner as well this year. So we are hoping we can both engage through our slide presentation, but really leave time for you all to ask questions because I'm sure that you have them. If HUVA isn't any indication, there are lots of questions about the LGBTQ Press 3 line. There may be others related to federal funding, but we also want to spend this time talking a lot about what's happening at the state level and give you some tools and tips for leaving this room so you feel empowered to take this information back to your own states. So with that, I also want to set just sort of what we're trying to do here, in addition to what I just said. The reason this session kind of came to fruition from the beginning is because for those of you who were here at our forum last year, would you mind raising your hand, somehow indicating? So a lot of you. So you likely recall that the theme of our forum last year was 988. And a lot has happened over the last year related to 988. So we really wanted to touch base with you on all of that. Also, here at the 2025 Forum, 988 has been, of course, a hot topic. We expected it to continue to be, but with some of the funding cuts, the LGBTQ line, and others, there's a lot of recent news that we wanted to spend some time going over. All of that said, and this will be reiterated to the larger room as well, you are not expected, we're not asking you to bring a 988 ask into your meetings this year. You are welcome to, if there's time, bring 988 up as a point of discussion that we support strong funding for 988, including the LGBTQ line, but it's not part of the two asks that we're asking you explicitly to bring into your meeting. So I just wanted to sort of set the stage on that, and we're happy to get into some more questions and other things you might have. Okay, so with that, I am going to start by talking about, that's the wrong thing, clicker, so some federal updates on 988. Okay, last year's forum was a theme around 988, connection, awareness, and follow-up services. That is what our 3 bills were all about. We focused on that crisis care continuum. We wanted to share a little bit about where those bills are now because of all of your hard work. The last 118th Congress did end in December, and because of your advocacy, those bills all ended up with stronger support. Now, none of them, unfortunately, passed, but as you heard, as Samantha Kohler, the health legislative staffer for Senator Kaine said this morning, typically the process is you introduce a bill, you have support for the bill, then maybe 10 years later it's enacted into law, right? So the fact that none of these passed Congress last year is not an indication that there wasn't support for them. In fact, all 3 of them had additional co-sponsors, thanks in large part to your advocacy. The Connect Act also, we only had a House bill last year. For those of you who were here with us, you might recall that we were actively looking for a Senate co-lead. Thanks to your advocacy, we had several that raised their hand to say they wanted to lead the bill. And so we have a couple in the wings ready to introduce it this year as well. So the first bill was the Improving Mental Health Access for Students Act. That was what we called our student ID bill. That's getting 988 on student IDs. Specifically, this bill was for higher ed. So the bill was actually recently just reintroduced this Congress, bipartisan in the House and Senate. Really, the same sponsors last year said this is still a high priority for us. And the fact that these are both Democrat, Republican sponsors, despite what's happening with federal funding, there is still a lot of strong support for 988. And you can see that by the ongoing bipartisan support for these bills. So those bills have been reintroduced this Congress. The Local 988 Response Act, that was the bill about geo-routing. So geo-routing, many of you are nodding your heads. This is all about making sure that if you dial 988 from a cell phone, you're going to get connected to a local contact center that is local to your geographic area, not to whatever area code your cell phone is pinging back through. So while this bill didn't pass, it included both geo-routing for calls and texts. We are seeing the implementation now, and already have for the major carriers, of geo-routing nationally. So this was a huge win just in terms of the larger picture of what this bill was trying to do. And I'll get a little bit more into geo-routing in just a minute about what the status is with that. I do want to say, related to geo-routing, the texting piece, I'll talk about this in a minute. We're still kind of looking at what the FCC might do there. So there may still be a reintroduction of this bill. We're expecting there will be, in fact, in both the House and Senate, because our champions on the Hill are not done yet. They recognize that geo-routing for texting is still really important, and to make sure that the portions of the bill that did not get addressed by FCC, and even those that did, are enacted into law. They are statute, so that the agency can't sort of just move away from doing geo-routing in the future. And then follow up, the CONNECT Act was all about providing a new grant program through the Substance Abuse Mental Health Services Agency, SAMHSA administration, SAMHSA, to provide funding for follow-up services for those folks who are calling 988, have things like follow-up phone calls, other outreach done, so it's not just a one-time contact. That bill we are also expecting will be reintroduced. There are follow-up service funds available through some of the funding, federal funding for 988, so some of that work is still happening. But our congressional champions are very much of the mind, and all of you, many of you who were here, and also those who took action from home, had a real big impact on members of Congress. They understand that there's still need for these follow-up services and additional funds. Okay, geo-routing. So for calls to 988, as of November 2024, geo-routing is now required and happening for the three major carriers. That includes Verizon, AT&T, and T-Mobile. So if you have one of those carriers, if folks in your community do, when they call when they call 988, they'll be connected to a local contact center. The smaller non-national wireless providers, those groups representing them and the providers themselves, during the Federal Communication Commission's open comment period, those providers raised concerns about the implementation of this, the burden that there might be on implementing as smaller providers to ensure that geo-routing happened. The FCC recognized that by saying, listen, you still need to do this geo-routing, but you can have a little bit more time. So that will be required by the end of December 2026. As I said on the last slide, we still continue to advocate for geo-routing. Senator Padilla, Senator Tillis, they are very interested in continuing on along with other congressional champions to make sure that all contacts to 988 are being geo-routed, because they understand the importance of connecting to local resources. Okay. A little bit about funding. I don't want to get too much in the weeds on this, but I want to kind of provide a takeaway message, which is that last year we advocated for, so when I say last year, I'm talking about, there's so many years when we're talking about years, so I need to be more specific. Last fiscal year, 2025, we're now working toward advocating for funding for fiscal year 2026, but we are in fiscal year 2025. We advocated for about $602 million for 988. This was reflected of what was in the president's budget as well for 988 to reflect the growth that Vibrant was seeing and that was predicted. As many of you may know, the appropriations and federal funding process was, surprise, messy this past year, and we did not end up, as seems to be the way these days, with individual appropriations bills passed in regular order by the end of the year before the fiscal year started. No, we got nowhere near that, and what we ended up with was just a continuing resolution where funding levels stayed stable with what they were in 2024, so that $519.6 million. So where are we now? I know there are a lot of questions about this, and we can get back to some of them. You can grab me later if there's not enough time during our session here. 988 will continue. I know that there's been some chatter on social media, some misinformation, disinformation about 988 is going away. That is not true. SAMHSA is proposed to be put into this new Administration for a Healthy America under the Health and Human Services Administration agency. So those bureaucratic administrative changes are happening. 988 is staying as it is. Big 988. When it comes to specialized services, unfortunately, as many of you are well aware, the administration through SAMHSA announced just last week via press release that they would be eliminating the LGBTQ plus youth specialized services as of July 17th. So where initially there was a leaked draft of the budget where it said they were eliminating funding, and we thought, okay, this is not good, but this would happen in the new fiscal year. In fact, they are ending services completely as of July 17th. That does not mean that LGBTQ plus youth will not have access to the Trevor Project and other resources like the Trans Lifeline. So we certainly want to continue to get that word out there. But AFSP's position is that we are strongly urging Congress to reverse this decision. They have the power through their role as members of Congress in the legislative branch to provide funding for LGBTQ plus specialized services. In your materials, there is on Soapbox and in Whova, there is a fact sheet called the Federal Suicide Prevention Resources. It's a 2-3 page fact sheet. We included some information and talking points about LGBTQ specialized services and what's happening, including a link to Bob Gebbia's press release that came out just this past week about this change. So you will have those if it does come up in your meetings or if you'd like to bring it up there. The PBR for this year, that's the president's budget request. So this is what the president is proposing to Congress that the administration would like to see, and it typically serves as a guide to Congress. It certainly does this year as well, particularly in the House. The funding level maintains that $520 million. This is less than what is needed. It's less than what AFSP requested. But worst case scenario was that, we wouldn't see funding levels anywhere near this. So in terms of big picture, this is relatively, a decent number. And we will, of course, continue to advocate for at least this level and really more moving forward. Just really quick, I'm not going to get into too much of this, but there's been a couple questions on Whova about data. SAMHSA does make 988 data available. If you just even Google, I put the source there, but I know it's not a QR code to access. Those performance metrics are available. I will note that they haven't been updated since March. We're now in June. So there are some concerns about the just keeping that data up to date. There are a number of reasons why this might be, including, as you well know, many staff are no longer employed with the agency, and so therefore it may be an issue of staffing keeping this data up to date. Yeah.
I will say, and I go into this, but on Vibrance, on the 98.org website, they do have state reports from May.
Perfect. Yeah. Great. Okay. All right, I see a couple cameras, so I'm not gonna move on just yet. But obviously you can see almost 4.6 million contacts. That includes the calls, texts, and chats. This just keeps growing. I didn't include the graph, but we know that every month these have been growing. On the next slide, I included the LGBTQI+, just so that you can see. So when we talk about the 1.3 million contacts that have been made to the LGBTQ line, I know there have been some questions on Whova and otherwise about, well, 1.3 million since when? This is when the pilot program first started in late 2002. You can see the tracking upward, 2022. I've been around DC a long time, but not even that long. So thank you for correcting me. And I just highlighted up at the top that 1.3 million contacts number. It's almost 1.3 million. Okay, this is my final slide. So what's next? In the big picture of all of this, we do have an exciting anniversary coming up, which is the 3rd anniversary of 988. Now, it is a little tepid this year, given that the next day, we know, July 17th, would be the end of the LGBTQ Specialized Services line. But we can hold two things at once, right? We can celebrate the 3rd anniversary of the line, which we've all worked so hard for. So many of you in this room have done so much advocacy in support of 988. And we can also continue to say, this is not the time to eliminate LGBTQ Specialized Services. We will continue talking about the need for increased funding for 988. We will continue to track and where there are opportunities, get the word out about the FCC's process, that's Federal Communication Commission's process on geo-routing for texting. Is that moving forward? If not, we need to ramp up our efforts with our members of Congress to make sure that that's enacted so the FCC is directed to do that moving forward. And if you were here last night for the reception, you heard from Congressman Obernolte, who mentioned in his video remarks that he had introduced the 988 Lifeline Cybersecurity Responsibility Act. This is bipartisan legislation in the House and Senate to make sure that if there are, any sort of cybersecurity incidents with the Lifeline, that those are reported immediately, that there's reports on what happened, and that information is more transparent. AFSP supports the legislation. It recently passed as part of a larger package in the House, and we're hopeful that it will continue to move in the Senate as well. That was not my last slide. My last slide is really this. Just wanted to make sure you're still listening. I just wanted to highlight a few new resources that came out this year. New national guidelines for behavioral health care coordinated crisis care system. We, AFSP, worked with our Public Policy Council to submit recommendations that the final guidelines did incorporate some of our changes there as well. So take a look at those, very relevant to what a lot of you may be doing at the state level as well. Then that is still not my final slide. This is my final slide. I promise I'm not going to be up here all day. We do have this action alert up. You can use the QR code from here. It's the same QR code that you saw on the poster by registration. So if you miss it now, go grab it later. This is to link to our federal funding action alert, which includes an ask specifically related to the LGBTQ line, asking for strong federal funding for 988 and our core other programs as well. Now, let's talk state. Thanks, Taylor. Thank you. I need the clicker.
Okay, hello everybody. For those who don't know me, I'm Taylor Kleffel. I am now our Director of Legislative and Policy Analysis, but before that, I worked on our state team, so many of you have probably gotten a lot of emails from me and worked with me on your advocacy action days in the past. So since 2022, and I'm going to pull this up on my screen here too, we've officially endorsed the Model 988 implementation bill on the state level. And essentially what that was after we got the Designation Act passed, we slipped in that language that said, and by the way, states can fund 988 through telecom fees just like 911. It didn't say they must, but it was a win just to get that in there, to suggest it, especially during a Republican presidency, was a big win for us. So that bill includes that fee. It's evolved over the years to adapt to changes state to state, but it includes a full continuum of crisis care, real-time info sharing and communication, so that's especially like with 911 operators as well, data collection and reporting so that we know how the Lifeline is working, and then the funding mechanism. I do want to mention why the fee is so important real quickly. So Sustainability, reliability. State general funds are great, and those are also a win, but you are asking for those every year, every 2 years. And for those of you who have been in the field doing that, you know how exhausting that is. Anyone who's worked at a nonprofit that relies on grants, you know how exhausting that is. So we want something that's reliable and sustainable. That's where the fee comes in. I also want to point out that this year we got really back to funding. We had kind of gotten some pushback from state legislators because we did have ARPA. We had the COVID funding that went toward 988. And so it was kind of like, we've got this covered. We don't need to talk about this right now. So we had kind of stepped back a little bit, but that wasn't going to last forever. So this year we really were pushing again for the fees. So and Siobhan will go into this a bit as well, but just as a reminder, effective crisis response system includes 3 components. So also in the Designation Act, what we slipped in was funding can go towards these 3 things. Now, for those of you who have been fighting on the state level, I want to acknowledge that you might have received pushback on this, whether it's from the telecom agencies behind the scenes or from the legislators themselves, saying, no, this should always only go to the contact centers or call centers. That's wrong. The 988 fee can go towards, we want it to also go towards mobile crisis response as well as crisis stabilization. 3 components to a crisis system. I'm not talking long-term mental health care. This all falls under crisis services. Okay. So for the next slide, I wanted to give this visualization of how calls have spiked in the various states. So the increase ranges from 26% in DC to 396% in Maine from May of 2022 to May of this year. That is huge. We knew it was going to happen, but having it visually out there, I think, is really important. So this has every state. We will have these slides available so you can take a little bit of a closer look. But I mean, you'll see everyone's increased a lot, and that's not going to stop. And especially because this is only accounting for calls. We're not even accounting for texts in this. And this data is available on the Vibrant 988 website, which is 988lifeline.org. Is that right, Emily? I think, and they have state reports so you can go in and see your individual. Now, this is also going to change with the geo-routing, right? So if you were in a state that has a lot of people that moved there, like New York or what's the one now, Nashville, so Tennessee, you might have a lot of people who were calling, but it was going to their states. So we are going to see some of these big changes. So that's going to be something to track as people are actually getting calls answered where they're calling from, right? Yes. Oh, sorry. It's from May. You're right. There isn't. It's from May 2022 to this May. So I wanted to do the most recent month we had for this year. So it was about a month and a half before it launched. Yeah. Then we also have in-state answer rates. So the most recent, maybe we don't. All right. I can see the maps on my screen. Well, the slides on the app should have them, but I can tell you the most recent in-state answer rates range from 58% in Arkansas to 99% in Rhode Island. Go Rhode Island. Those have steadily increased. That's good news. That's not going to keep happening, though, if we don't continue to provide funding. So I want to couch that with, yes, it's good news, but we have to keep that up. And especially the states, like I said, who are going to have to adapt with this geo-routing, need to know the changes that are going to be happening. I worked really hard on those maps. I'm really bummed that those aren't up here. I even have them in pink and green AFSP colors, but those should be available once we put the slides up. 11 states have enacted the fees. Not too shabby. We've got about a fifth of states, right? So we really have made progress, and you'll see it really varies. And Illinois just passed a 988 fee in their budget bill, so we may soon be up to 12. So really, really exciting. And for those of you who are in states that don't have a fee, I want to also say, though, that doesn't mean that you haven't made a lot of progress. There are multiple ways that we can be effective in 988 funding, but it is pretty cool to see this just from where we were a couple of years ago. So with that... They did. Okay, so that's 12. So awesome. Thank you. So on that note, I want to point to the additional 988 legislative efforts. So there are funding alternatives, right? Even if you can't get a fee, and I know this is what we did, I don't know if we have Maryland folks here, but we did in Maryland. We were having trouble getting the fee passed, but we thought, okay, we can at least set up the trust fund first so that any funds that are collected are going into that trust fund and cannot be diverted. That's still a huge step. And that's not just the fee money. Anything we get from grants, donations, budget funding, that will all go into that trust fund. Then we also have appropriations, like I just mentioned, state appropriations. 5 states currently have recurring appropriations. So, for at least it might be 5 years, 10 years, but that is also a big win. And then we also have, there's an option to mandate commercial insurance coverage of the crisis care continuum. I believe it was Maryland had a bill like that this year. And then also to help strengthen state systems, the federal government offered states additional Medicaid funding to grow their mobile crisis services. So that was available under ARPA, provides states an 85% federal medical assistance percentage for mobile crisis for the first 3 years of implementation. So the opportunity began in 2022 and will end in 2027. And I believe Emily states can still, at this point, opt into that. So some ways that we get creative. I know Medicaid and all that can be very complicated, but it doesn't just stop at the fee, right? And then there's also a lot of work to do with infrastructure. So that doesn't necessarily require a big fiscal note. So training 911 operators to know when to divert calls to 988 and vice versa when there is a medical emergency that needs an ambulance or EMT response. And then studies, work groups, and state plans. So I don't know if we have anyone from Texas, but in Texas we passed a bill to have a state work group put together to study what the situation was with 988 in their state. And that's not nothing, because I know that when you go in those meetings, legislators often will challenge you, well, how do you know how many calls we're receiving? How do you know if this funding will really work? How do you know how much funding we need? And if we have a study that was done and we can point to it, that can go a long way as well. And I want to make sure I have our wonderful Siobhan enough time. So I'm going to go through this really quick, but I kind of mentioned this, but what we've learned, each state continues to be at a different point. This does not mean that you're not making steps. I mean, every day we're making steps, and every couple of years there's an election and there's new folks to introduce to 988 and to educate about 988. Some states still are in that education process. That's still really important, and that's something we can do. You can go into your capital and offer a PowerPoint on 988. They did that in North Dakota for legislators and their staff to make sure they understand how it's operating. And you might get a sponsor for a bill out of that. And that's something that people who are maybe more well-versed in the program side of AFSP can participate in our advocacy activities. I did talk about the counter opposition from telecom industry. So we did put out, I think in 2023, a press release kind of pushing back on the idea that money could only go towards certain funding. So that's something that we're doing on a national level. And the parity with 911 funding fees is the other thing I want to bring up really quickly. Start high, right? So what it said in the Designation Act is you could have fees up to what they have for 911. You're going to get bumped down. You'll notice if you compare 911 to 988 in those states that have it, it's a pretty huge difference, but there's no reason not to start high and see where you can go from there. And then I do have coordination with law enforcement. I want to mention that as part of the relationship building piece. So state coalitions is a big thing. In Kansas, they worked with the sheriff's union, and the sheriff's union went and testified in support of the fee bill, which in a more conservative state often can go a long way because of support for law enforcement. Hearing from them that they don't want to be responding to these types of calls. They know they're not equipped. They know that we need the people who are equipped to be answering them, and therefore they support the fee, right? And it's not an either or. You can have a 911 fee and a 988 fee. It doesn't take away from what we're doing for 911. And then I wanted to mention, too, in Rhode Island, what they did, is they had the legislators tour the 988 centers so they could get a better idea of what it's actually like on the ground and how that system works. A big gap still is the education. People get a little confused about how a national lifeline works, but it needs to be state funding, and that can get a little confusing. So just utilizing those coalitions, and I'm going to have Siobhan will talk a little bit more about that. And last thing I want to say, what happens on the federal level, does it affect the states? Yes. But no, also, right? We can still do the work we're doing on the state level. And in fact, we can use the messaging that says, we don't know what's going on with the federal budget. We don't know what's going to happen to 988 funding. But here in your state, you can make sure your constituents, when they call, someone's answering the call. You can do that on the state level. You have that power, especially too with geo-routing now. They know if someone's calling in their state, it's being answered in their state. Those are their constituents. Those are the people that they should be caring about, right, that they work for. With that, I'm going to pass it to Siobhan. Thank you.
Okay, so hi everybody. My name is Siobhan Power, and I'm our advocacy co-chair and an advocacy ambassador from the New Jersey chapter. So I know a lot of you raised your hand and said you were here last year when the focus was 988, but how many of you are here for the first time? Okay, so a lot of you. I just want to share quickly that this really is a full circle moment for me, because the first advocacy forum I ever attended was in 2018 when we were pushing for that change from the 10-digit number to 988. So know, as we've already heard today, that this work doesn't stop when you leave here, and there will be things that you will be able to do and continue in the years to come. So it's been really important to me to try to help pass this the telecom fee in the state of New Jersey. So important that we actually made it the entire focus of our Advocacy Action Day this year. We said there is one thing that we want to focus on because it is so important, and it's passing the 988 telecom fee. So in New Jersey, the 911 fee is 90 cents, and what has been proposed in New Jersey is a 40-cent telecom fee. So as Taylor mentioned, it's not as high as that 911, but it's palatable. So something that we spent a lot of time working on with our state partners is coming up with messaging that would really resonate with the media and with our legislators. So we took that 40-cent fee, we multiplied it by 12 and said that's $4.80 a year. That's less than the cost of a cup of coffee. So wouldn't you be willing to pay less than you pay for one cup of coffee to help save the lives of New Jersey residents? And that was something where people have a hard time saying, no, that's too much money. No, I don't want to do it. So messaging is so important, and messaging really, really matters. And that was even the subject line for our 2025 action alert. Would you spend less than it costs for a cup of coffee to prevent suicide? So currently, in New Jersey, in 2024, our 5 988 contact centers received an average of 7,361 calls per month. That was a 42% increase from 2023. And we have seen, because prior state funding actually had a public awareness campaign, and in the areas where we had those big billboards and in the places where we had this messaging, we would see increases. So we should expect that people will keep calling and this number will go up. So we need to make sure that people don't just have a number to call, that they have someone to respond, and that they have a safe place to go. So those are the mobile crisis response teams in New Jersey in April of 2025. These went out statewide and are fully operational, but they're not operational 24/7, which is a gap. And that is something that we're hoping a telecom fee will help close. And then somewhere safe to go. Right now, these are being built out in New Jersey, but it is from state funding in the state budget, and we want to make sure that we can continue to expand upon this and to meet what we expect to be an increasing need. So we did do a lot of work with our state partners. And what we did is actually tap into people who we've worked with on our advocacy action days in the past. So we've worked with NAMI New Jersey. We've worked with the Mental Health Association of New Jersey to co-brand past advocacy action days. And what we did earlier this year was send a partner letter to all of our state legislator leaders to let them know that all of our organizations are very committed to getting this telecom fee passed so that we have the full crisis continuum of care for all New Jersey residents. And right now, and in many states, I know it can be kind of piecemeal. So if you're in this part of the state, you have access to this. If your town received funding for something, then you have additional options. And what's really important to us in the messaging we're trying to convey is that no matter where you are at the time of a mental health crisis, you should have the same access to that high level of care. Not just somebody to call, but someone to respond and a safe place for you to go. So a few other things that we did with our partners just to build upon this and make not just an advocacy action day, but we had a full advocacy action spring. And since the legislation is not yet passed, it's continuing into the summer. We held a virtual town hall with NAMI New Jersey, with the Mental Health Association of New Jersey, and with Inseparable, which is a national mental health advocacy group. And we actually had the senator who introduced Senate Bill 4502 in New Jersey to allow for that telecom fee speak on this town hall and explain why it was so important to him and what he has heard from his constituents. So bringing in lawmakers who have introduced legislation or who have heard a lot from their constituents and know how important it is can be really helpful as you are doing some of this messaging. Okay. So that's a lot of the work that we've been doing in New Jersey. We also have media alerts, but I want everybody here to know just how much there is available at the national level at AFSP to help you. So Taylor and Emily have both been amazing, the full public policy team. And on Chapterland, there is an advocacy area that's dedicated just to 988. There are testimony examples, there's an issue brief and social media graphics, and having access to that and sharing those with your lawmakers can be really, really helpful. And it's great, and I'm sure so many of you in this room are good at creating these things, but I don't like to reinvent the wheel, so I always go to Chapterland and say, what is in there? Because I know it's been vetted, I know that it uses safe messaging and safe language, and that's going to be a good starting place for us. The public policy team was also really helpful to us at the state level because we received a draft of the legislation before it was introduced, and we still really wanted to support it in our Advocacy Action Day alert. So as soon as that text of the draft legislation was given to us, we said, Allison, can you please take a look at this quickly with Taylor and tell us if it is something we can support. So they are always responsive. They know that often we're operating on tight turnarounds and deadlines, and these things need to get out there. So they are incredible. Same thing with our communications team. With creating social media graphics or helping if you want to reach out and speak to members of the media. They maintain all of the lists of press contacts, and they can help you prepare for any of those meetings. And then my favorite thing probably, which is new. Oh, well, this is what Chapterland looks like for 988. So these are a lot of the social media graphics, the policy priorities, examples of testimony. The state quorum pages. So has everyone seen this before or knows that it's available? This is a tremendous resource, and I'm going to see if clicking on the link works. Okay. Okay, so clicking on the link is not going to work, but everybody here has a state quorum page, and the URL is afsp.quorum.us/the name of your state. If the name of your state is 2 words, there's a dash in between. the two words, but this is broken down by the policy area. So I think I didn't sort it so that 988 appears on the top, but it shows you the policy area. If you want to look at only 988 legislation, you can filter it and it'll pull up all of the key state bills that have already been introduced so that you can take a look at that. And then it also tells you, is it in committee? Is it out of committee? Has it been amended? Is there a committee meeting scheduled? Because that really helps you to know who are the key legislators in your state that you need to reach out to, and something that your state staff member and your advocacy committee and public policy committee chairs have is a list of all of your state advocates with their district. So if there are legislators on a committee that you want to make sure you're talking to about this legislation, you can identify who is an active advocate in your state, who is one of their constituents, and then try to reach out together to get that messaging across. Okay, so then I know we want to save time, so just a couple of other ideas is incorporating advocacy into other chapter events. So that's something that we do at all of our walks. We have a table. If the 988 telecom fee is still not passed in New Jersey, we will be there asking people to reach out to their state legislators and assembly people, because we want to make sure that this is something that we see pass. And I know many of you have, or everybody here has access to Chapterland because we used it for registration, but not all of our chapter volunteers have access to Chapterland. So something that we also do is create a shared Google Drive for our advocacy resources. When there are social media graphics, when there's legislation we want to get support for, we put that in our shared Google Drive, and then we're constantly updating that. We also record our virtual advocacy events as a chapter. So because our Advocacy Action Day was solely focused on the 988 telecom fee, we have had legislators who are interested in sponsoring reach out to us for more information, and we've been able to send them that recording and say, we're available to talk to you more, but we think it would be a good starting place for you to take a look at what we spoke about and all of kind of our information that we shared. I think, Taylor, this is one of your slides, but we want to get to questions, so back or?
You can just leave that up.
Okay.
Yeah, this is kind of just building on what John said. So like we mentioned, testimonies, letter of support. If you ever want to do more beyond your action day, we are here to help you do that. And then if you go to the last slide, there's some links there. And we will make sure this is all on the Luba app slides as well. So I don't want you to worry about all of this, but just know these resources are there for you. And we have 2 minutes for questions, Emily. You ready? Oh, gosh.
All right, any big questions? Rapid fire. You can also ask on the Whova app. Emily and I will be checking that and answering those on there as well.
Somebody's got to ask.
How does one get involved, like, as a crisis responder? Like, how do you volunteer for 988, especially when we are experiencing all these cuts and loss of jobs? Like, how would someone be able to volunteer and how they can be trained to be a responder?
Sure. So if you go on 988lifeline.org, all of that information is there on how to get. It's going to be through the contact center in your state. So in your state, there might be crisis centers that are not with the 988 Lifeline because they don't necessarily follow the standards. But the ones that are, their contact info will be on that website, and you're going to go to them directly. But it also has some more general information for you about what that looks like. Yeah. Do you have a question?
I just wondered how education and marketing is funded.
So,
Because I mean, so many people have no idea what it is.
yes. Yes. So I will say in the model bill that I mentioned that we endorse, if you use the full version, which some legislators only take pieces of it, we do have that funding should go towards education. We have had some states pass bills where we couldn't get anything else through, but we did get a fiscal note, or we got in the state budget a line item specifically for public education. I don't know where that's at.
Yeah. I mean, the federal funding can also be used for education and awareness. So the big like 988 campaigns you might see, not every city or state has them, but many do. There's all kinds of like 988 Day in September has a lot of like promotional materials available. That's federal funding through SAMHSA. There have been standalone bills. Congressman Beyer, Congressman Fitzpatrick have introduced legislation in past Congresses specifically focused on awareness campaigns, and that's something that's definitely something very much of interest. Part of the federal discussions around awareness campaigns is where's the most need, and if we put all of this money into awareness and then we can't, meet the need, how do we sort of, figure out that challenge? And that's all it is. It's a challenge to figure out. The money is needed in so many different places, and there are many efforts to try to, bolster that funding.
And if I could just add, we're about wrapped up here, but also once you get that funding, how is it used? If you feel like the public education in your state isn't really effective or could be done better, call your legislator's office, call your Department of Health and Human Services, who probably is the one who has the funding and is in charge of building those campaigns, and say, how can I get involved? Do you have a work group I can sit on? I represent him. If AFSP is part of that work group, find out who in your chapter and talk to them, because they might have the funding, but they might not use it the best way, right? We know what's going to be more effective. So get involved and learn how you can do that as well. And with that, thank you all so much.